Hi there, welcome back. Well, we're talking about strokes, and in this segment we're going to talk in a little bit more detail about what strokes are, how they're diagnosed, what some of the warning signs are, what we can do to try and prevent them, and of course what the good news is in terms of therapy. And I want to introduce another guest that we have here, another special guest in our segment. This is Dr. Erfan Albakri. Thank you so much for coming. You are someone who's very familiar with strokes. You are a stroke neurologist, and you're also the chairman of the Florida Stroke Prevention and Education Coalition. And if that's not enough, you're also the clinical assistant professor at the University of South Florida College of Medicine in Tampa. And thank you so much for coming.
Thank you for having me.
I appreciate it. You just heard our other guest, Barbara Newborn's story of experiencing a stroke at such a young age. She was only 21. Is that typical of what you see in your practice?
There is approximately more than 25% of patients less than age 65 would have a stroke. Unfortunately, a stroke was thought to be a disease of older age.
Yes, yes.
It's not anymore. It's actually we are discovering more risk factor for stroke, or we can diagnose stroke early during early childhood. We have seen infants with stroke, younger adults with stroke, teenagers with stroke. It depends on the risk factor, so nobody is spared if they have the risk factor.
Then they're at risk, and they could potentially have it.
Stroke,
well, we just heard about the smoking and the hypertension, and everyone knows on the show, I'm always screaming about cigarettes and how dangerous they are. I mean, it's like if you want to hurt yourself really bad, then just smoke cigarettes, and if you don't, then stop smoking. So again, this is another example of how smoking puts you at increased risk. Barbara, did you have any risk factors for stroke?
Yes, I was smoking, and I was taking the same birth control pills as Miss America.
Is that right?
Who had the stroke.
Oh, my
and
goodness.
I had a high blood clotting factor, too. So,
really?
Yeah, I didn't know that until much later.
Okay, all right.
So the three combined.
All of those things put you at risk, and I'm sure there are a lot of people walking around like Barbara who have no idea that they're at increased risk.
Unfortunately, that is true, because the problem with these kind of risk factors are not detected early on unless the person would have signs and symptoms related to these risk factors. For example, people who had migraine, which is some of the common headaches that we hear about that can start at early childhood.
Yes.
It was found in one study was done in France that women less than age 45 with migraine are at higher risk for stroke than women without migraine. Their risk factor for stroke that related to hereditary or congenital abnormalities in the blood vessels. There's certain abnormality of the blood vessels or the cells themselves also that can increase risk for blood clots, like sickle cell anemia or sickle cell disease, which is common in younger children.
That's right.
That can cause stroke.
Wow.
Hormonal replacement and high dose estrogen is at risk, increased risk for stroke in women in younger age.
That's so interesting, because as you mentioned at the very beginning, we think of stroke as something that happens to people in their later years, but we're seeing this now in higher rates. Now, in the package that you just saw, there was a mention of a mini stroke, or TIA, which we are all very familiar with. Dr. Albakri, could you explain to our viewers what we mean by that?
TIA means a transient ischemic attack. It means a transient blockage of a blood vessel that resolve. There is no brain injury, there is no brain damage that affect the brain. However, the symptoms of stroke that may occur over a very short period of time and resolve. And that is an opportunity for people to seek treatment and identify the risk for stroke and treat it early on.
It's kind of like a pre-stroke. It's like you might go on to develop a stroke.
It's like angina. If somebody had a heart attack or somebody had a chest pain is the predisposing factor or the event that occurred prior to heart attack. And TIA is the same presentation. that patient would have transient symptoms without complete injury to the tissue. They go on to have a stroke if they're not treated immediately.
And you know, it's so important that folks understand that, because I know, having been working in the emergency room, many folks that come in having a stroke will remember a time when they had a TIA where, you know, you had like something, or your tongue felt funny or something, or you couldn't use your hand for a little while, and then it went away, and you're like, thank God. And so you just keep right on going, and you don't really want to see the doctor because you're so glad that it went away and you just don't want to even think about that. But the problem is that that's your little warning that there's something wrong and that you might go on to have a stroke. You probably will at some point, and you've got to call the doctor even though the symptoms go away, because everyone's glad to see symptoms go away. It's like, oh, thank goodness, I almost had a stroke, but I fought it off. And it's like, no, 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 you didn't do that at all. This is a warning that you could go on to have
and that is the only opportunity that we can early detect the risk factor for stroke and treat it immediately.
Yeah.
And unfortunately, there's approximately more than 75% of TIA. They don't last more than 5 minutes. So 5 minutes transient symptoms, people, they would ignore it. I'm back to normal. I shouldn't worry about it. I shouldn't tell my doctor.
Exactly. Keep
it's
it a
very
secret.
important to tell your doctor if you have a symptom like that or seek medical attention as soon as possible.
Absolutely. And we've got a caller on the phone that has a question. So we're going to go to our phone lines. Our first caller is Margaret. Hi, Margaret.
Hi.
How are you?
Good. How are you?
Just fine. Thanks for calling. Go right ahead.
My question tonight is, what is the difference between stroke and a seizure?
Okay. You know what? I can understand why that would be something that could be a little confusing, because we think of, strokes, and it involves something going on in the brain, and then of course seizures again can involve something with the brain, and so even though they look quite different, they may be a little confusing. How do we distinguish them?
Stroke is a blockage of a blood vessel that causes damage to different cells or cells in the brain. Seizure is an electrical activity related to a scar in the brain or damage in the brain. There is approximately 30% of stroke that affect the cortex, or the cortical portion of the brain, will end up with a seizure. Patient will go on to have a seizure. They can present with a seizure, which is electrical activity. So there is a difference in the mechanism. The seizure is electrical activity related to an injury. And stroke that can cause the injury. Stroke is a blockage or damage of the brain cells that lead to other complications.
Okay,
and one of them is seizure.
Well, we are off and running on this topic. As you can see, there's a lot of things to talk about. It's such a fascinating and very important topic, and we're going to give you more information in just a few moments. Stay tuned. We're going to go to Health IQ, though. Be back in just a few.